Hello.
Hello.
Welcome everybody again. Nice to see you all. This is the last session of Parapsychology Foundation Forum, Recent Advances in UK Parapsychology. So this is the last of our 5 talks. And remember, all of the lectures are being recorded and will be available in the next few hours, we hope, in terms of the WizIQ one. And then we're also recording them for the launch of the Parapsychology Foundation YouTube channel, which we hope will take place over the next week or so, maybe even sooner. All right, let me get going, and I just wanted to let you know this is our last session of the day of the forum, and our upcoming presentation will be done by Dr. Elizabeth Roxburgh from the University of Northampton. The title is, What is Clinical Parapsychology? An Overview of Anomalous Experiences and Mental Health. So let me tell you a bit about Elizabeth. She is a senior lecturer in psychology at the University of Northampton, where she specializes in qualitative research methods, the psychology of anomalous experiences, mental health, and counseling. She was awarded her PhD for research exploring the phenomenology and psychology of spiritualist mediumship. Elizabeth previously worked for the National Health Service as an assistant clinical psychologist in a variety of settings, including mental health, forensic psychology, and learning disability services. She's now a BACP Registered counselor and volunteers for the Spiritual Crisis Network. So let me get to Elizabeth's slide here. Okay, I'm going to shut off my video and my microphone, and I'll be in the chat if you need me.
Okay. Hello and greetings from Greenport. I'm assuming most people are familiar with the term anomalous experiences, but just in case they're not, I thought I would give you a brief definition. So anomalous experiences have been defined as those that depart from the more from our own familiar personal experiences, or from the more usual, ordinary, expected experiences of a given culture and time. So some anomalous experiences that have been reported in the literature include some of the things that we've been talking about today. So mediumistic experiences, sensing the presence of the deceased, out-of-body experiences, near-death experiences. Another term that's been used to describe anomalous experiences is exceptional human experiences. So this accounts for some that can be a really positive, transformative experience. And one of those is spiritual crisis, which is what I'm going to kind of talk about today and describe what that is. So in today's talk, I'm going to be talking about a growing field within parapsychology itself, which is termed clinical parapsychology, which is interested in exploring the interface between anomalous experiences and mental health. So hopefully, after 30 minutes' time, you'll all know what anomalous experiences are reported in the literature and how some of these can be transformative. I'm going to tell you what spiritual crisis is, how to recognise it, and what some of the therapeutic interventions are. You'll hopefully know what a clinical parapsychologist is and what some of the clinical parapsychology research findings are and what some of the implications are for mental health practice. Firstly, I thought it was important to briefly describe how mental health is understood in Western world. So in the UK, in Europe and in America, the medical model is the current paradigm in the practice of psychiatry. And this is based upon a diagnostic model of mental disorders. So psychiatrists will use something called the DSM. It's a diagnostic and statistical manual of mental disorders. So they will assign particular symptoms that people are experiencing to a discrete category of a so-called mental disorder. So it's a categorical system of classification. People will be classified as having a mental disorder or not. However, mental health is much more complex than this, and the either-or distinction isn't very useful. Many psychologists prefer to see mental health issues as running along a continuum, from really healthy to people experiencing psychological distress. And most of us will run along this continuum at various points in our life, depending on our circumstances, resources, and support system. There's been lots of criticisms of the medical model itself. Many psychologists have said it's not a reliable or valid way of understanding mental distress. And a lot of kind of normal experiences are pathologized as being a so-called disorder. An example of this is homosexuality. That was only recently taken out of the DSM in 1973. Other criticisms are that there's lots of financial ties to pharmaceutical companies. So, for example, there was a 200% increase in so-called disorders from the first DSM-1, which was out in the 1950, to the DSM-5, which is the current one now. So a lot of people have argued that the medical model doesn't take into account people's transcendent experiences, the transformative process of anomalous experiences. So, for example, we've seen today that some common experiences are sensing the presence of the deceased, but this could be interpreted as symptoms of a mental disorder, such as hallucinations in schizophrenia. So there's a risk there that health professionals will ignore the transcendent or paranormal aspect of experiences, or at worst interpret them within this framework that they would give a pathological diagnosis. And I'm very critical of this view. Things are changing in the UK, and there's a group of service users and clinicians who have drafted a manifesto for a new way of looking at things, a new paradigm. So the medical model is just one way of looking at things, looking at emotional suffering. It might be a useful way for some people, but there are different interpretations which may resonate more with others. So there's a need to develop a more shared understanding of experiences on a case-by-case basis. And this may involve interpretations that fall outside of Western notions of illness. So the New Paradigm Alliance actually says that we should listen more to people and label less. We should collaborate more and impose less. And we should connect more and medicate less. And we should encourage more hope, which is what kind of Cal was talking about earlier in his talk. Before I tell you about some of the research findings in clinical parapsychology and some of the research that I've been doing, I'd like to share with you a trailer that's a documentary being currently made in the USA, so some of you may have already heard about this, and it's about how in the Western world some anomalous experiences are seen as psychosis. However, in other cultures and within many psychologists, they're seen as something called a spiritual awakening or a spiritual emergence. So this is a short trailer for this documentary that hopefully Nancy will help play for you now.
Don't worry, folks, if you can't see it, we'll be putting the link into the chat after the video plays.
Okay, so what the video was doing was actually talking about a concept called spiritual awakening, otherwise termed spiritual crisis. And transpersonal psychologists Stanislav Grof and Christina Grof actually started this in 1980. They set up the Spiritual Emergency Network in the USA. And they define a spiritual awakening as non-ordinary states of consciousness that in the West would be seen and treated as psychosis and treated mostly with suppressive medication. But if we use the observations from the study of non-ordinary states and from other spiritual traditions like shamanism, they should really be treated as crisis of transformation or crisis of spiritual opening, something that should really be supported rather than suppressed. And if properly understood and properly supported, they're actually conducive to healing and transformation. So a spiritual crisis or a spiritual emergence can involve some of the anomalous experiences we've just talked about. Peak experiences, seeing visions, hearing spirit voices, mystical experiences, synchronicity experiences, and also something called kundalini experiences, which is a form of cosmic energy that is supposedly lying latent at the base of the spine. And this can be activated by certain spiritual practices like medication, causing the energy to rise up the chakra points and causing a wave of intense emotions and energy. And a spiritual awakening can occur at any time in a person's life, but often at times of intense emotional or physical distress, perhaps through substance misuse, spiritual practice, life transitions. And it can be sudden and unexpected, or it can be a more gradual process. So we see in the Chinese language The symbol for crisis is actually represented by the symbol danger and opportunity. And this reflects how a spiritual crisis can be both distressing, but also an opportunity for growth and transformation. And in terms of the danger, people can become out of touch maybe with consensual reality. They can perhaps experience sectioning and be pathologized with a mental disorder. Mental health professionals may not understand the process. They may kind of become isolated, and at worst, they may even commit suicide because of having these experiences. However, if it can be properly supported, it can be an opportunity to live life on a completely different level. They can have more meaning and purpose in life, more resilient to the ups and downs, and a strong need to be of service to others. So a spiritual experience can be seen as a normal process of human development, and it can involve the individual moving to more transpersonal realms of increasing relatedness to a higher power, to God or to universe, whatever kind of terms they want to use. And it can involve an awakening to a more expanded way of being, a kind of acclimatization to a more subtle level of consciousness, a kind of journey of self-discovery, and a process of learning and growth, of healing and purification. So a spiritual emergency then can be a natural process of spiritual unfolding. It can be gentle, gradual and graceful. But for some it can be a dramatic turning point, and this can often happen when the transformation is moving too fast, or when the person doesn't have a conceptual model of understanding that makes sense to them. They can also involve psychological difficulties because many aspects of the personality can surface. So parts of us that we've repressed, perhaps our shadow side, can rise to the surface, and it can be kind of impossible to cope with everyday life. In terms of recognising the spiritual crisis, it can involve a whole range of different key features. Some of these involve the following. So the intensity of the experience can consume the individual's whole being. It can be impossible to cope at an everyday level. Our inner world can take over, so people can report unusual imagery, vivid dreams, unusual sensations, and physical pains, finding it hard to sleep. They can experience a roller coaster of powerful emotions, from anxiety to sadness, but to euphoria as well, and it can often be very intense and overwhelming. There can be a sense of ego death or ego inflation. Thinking can become confused. Meaningful coincidences seem to be frequent when going through a spiritual crisis, and it can experience strong energies as well and see unusual things. In terms of what might help somebody get through a spiritual crisis, normalisation is really important. So people need a framework of understanding that makes sense to them, and this might not be the medical model. And normalisation seems to serve three purposes. Just knowing that other people have been through a spiritual crisis can be comforting in itself. But also it helps people to reframe the experience as well, from it being seen as something bad or sick, to it being seen as something that's positive and transformative. It also allows the process of healing to take place, because the person begins to accept the experience rather than suppressing it or repressing it. Also, grounding might help as well. Kind of being around nature, eating grounding foods that are quite dense. Body work may help as well, and massage. The person may need to temporarily discontinue their spiritual practice, because this may have triggered the spiritual crisis. Creative therapies help as well, and people may find a retreat useful because they can become overwhelmed by environmental and interpersonal stimulation. Medication may help in very low doses just to kind of numb some of that emotional suffering. And mindfulness as well has been found to be particularly helpful for people going through spiritual crisis. On the slide there's 3 books that have been written around this, and these are all really useful. One of them is by a psychologist, American psychologist called Emma Bragdon, and she wrote Helping People with Spiritual Problems. There's a reference to this at the end of the slides. She's currently working in Brazil at some spiritist hospitals there, supporting people going through spiritual crisis. In Case of Spiritual Emergency was written by Catherine Lucas, who set up the Spiritual Crisis Network in the UK, of which I'm a member, and they offer email support for people going through spiritual crisis. And then we have Mend the Gap, written by Katie Mottram in the UK, and she went through her own spiritual crisis, so she writes about that as being a really kind of transformative journey. So what is clinical parapsychology then? Well, running parallel to the New Paradigm Alliance and the changes that are happening in the mental health system and the way we see mental health, we are also seeing changes in parapsychology as well. So we've seen a shift from more experimental work to more process-orientated work and more kind of a qualitative research process. We're also seeing an increased interest in the practical implications of parapsychology. And, it's been argued that there's a real need to have a new field of study that can apply parapsychological findings. There's lots of pressure now in academic departments to do research that has real impact on the community, but also at an international level, that we can actually help people. So looking at anomalous experiences and mental health is one way of doing this, and this will fall under the umbrella of clinical parapsychology research. We also know that a large majority of the population believe in or experience anomalous experiences, and that most healthcare professionals tend to ignore the existential questions that people may have after having an anomalous experience, or at worst, people may become diagnosed and their experiences would be interpreted within a pathological framework. So it's argued there's a real need for a new breed of professional that would have knowledge of parapsychology research on one hand, but also counselling skills on the other, and perhaps also have had their own personal experiences as well, so they've got a greater understanding of how to support people that also may have anomalous experiences and become distressed by them. We do see that there are specialist counselling services already in existence, particularly in Europe, that are doing clinical parapsychology work, that are actually working with clients that report anomalous experiences, but they're also doing research as well. And excuse my French, one of them is called l'Institut Métaphysique International in Paris, and there we have Renaud Evrard and Thomas Riberon, and both psychotherapists who are doing work with clients with anomalous experiences. We also have Martina Bells, who's a clinical psychologist, and she's working at the Institute for Frontier Areas of Psychology and Mental Health over in Freiburg, Germany. And then we have Wim Kramer as well, who's doing some work in the Netherlands. So those kind of researchers and clinicians in Europe are gathering together some studies now that have actually worked with clients who've reported anomalous experiences, but also health professionals as well, who may work with such clients. So I'm going to tell you a little bit about some of the research that's been done over in Europe. So one of the first studies then recorded nearly 1,500 cases of anomalous experiences that were recorded at the German Institute in Freiburg. And they kept a record of how frequent anomalous experiences were being reported by clients. So they found some of the popular ones were related to poltergeist and apparitional phenomena. Clients were coming through kind of disturbed about having these experiences and wanted support, wanted to explore the phenomena. So 53% of these cases related to those kind of experiences. 41% related to extrasensory perception, 38% associated with things like spirit possession, 15% associated with things like sleep paralysis, 10% related to meaningful coincidences, and I think about 7% associated with mediumship. We also, they've also done some research with contact with deceased spirits. So over in Holland, they contacted a random sample of the Dutch population by phone. And, out of 736 people, 63% felt that contact was possible. And 40% said they had an experience. But what was really interesting was that, like, Cal was saying in terms of the grief process, 70% said the experience of contacting the deceased was really useful. What's also interesting is that 16% sought professional help. And unfortunately, over half of these said that the help that they received was inadequate. They didn't feel supported, they didn't feel listened to. And we're also seeing some similarities there with people reporting near-death experiences. So out of a sample of 155 questionnaires sent to the Dutch Association for Near-Death Experiences, again, over half reported the need for counsel, but some rated this as poor, And some of them said that actually when they sought counselling, it made their problems worse. So this kind of inspired me to do some research in the UK. We don't currently have any research at the moment looking at counselling for anomalous experiences. We don't have any of those specialist centres. So I got some research funding from the Bial Foundation over in Portugal to actually do some projects looking at this topic. So I'm currently involved in 3 projects. One is investigating the experiences of clients who report anomalous experiences. So we're better informed about how they felt disclosing their anomalous experiences to their counsellor. Did they feel listened to? Did they feel understood? I'm also investigating the experiences of therapists who have worked with such clients. So how did they address the experience when their client brought it up? How did they manage that? And then the third study is investigating the needs of students training to become counsellors and clinical psychologists, so they may be better informed to address these experiences. What kind of training do they need? Do they currently have any training on their programmes? So the interviews with clients then involved 8 clients that took part in the study. There was 3 men and 5 females, aged between 21 to 52, and they took part in semi-structured interviews. All the clients had experienced at least one anomalous experience, which they had discussed in counselling. And they all saw counsellors from a range of different therapeutic orientations and had at least 6 sessions following the experience. And an inductive thematic analysis was conducted on this data. So the title of the paper that I'm writing up from the clients' interviews is actually called "Most People Think You're a Fruit Loop." And this is because a lot of the clients just felt ridiculed when they shared their experience. There was actually 4 themes that came out from the interview. So the first one is you have to go digging to get support. So most of the participants said that they had to go and see several different people, several different counsellors, before they actually found one that would actually work with them, and they were able to kind of talk about their experience and explore their experiences. Often they went to see a counsellor, and the counsellor just really didn't want to know. The second theme was, why are you looking at the airy-fairy crap? So this kind of represents the reactions that participants received when they shared their experiences with friends and family. The kinds of reactions they received from people when they talked about their experiences were very derogatory. People said that they were balmy, that they were crazy. So this kind of really made them hesitant to actually talk about their experiences for fear of prejudice and stigma. The third theme was it kind of shut the door. So when they actually kind of sought counselling, a lot of them said that they felt dismissed, they felt closed down by their counsellor. It was very difficult for them to talk about their experiences and explore the meaning that it had for them. However, some of them said that they did find a good counsellor. So the fourth theme, having someone to normalise and say you're not crazy, you're not weird, was really important. This kind of represents the qualities that the counsellors had, that the participants really welcomed. So they said that it was really useful if the counsellor was non-judgmental, if they, were willing to kind of explore the experience with them. They said what wasn't helpful was when the counsellor tried to impose their own model, their own way of understanding the experience. That wasn't very helpful to them if the counsellor kind of tried to interpret the experience from their perspective. Researchers also started to look at the experiences of health professionals as well. So over in the Netherlands, a study looked at a sample of 129 health professionals to find out whether they'd actually worked with clients that had reported anomalous experiences. 59% of these health professionals said they had had clients with problems associated with spirit contact. 55% said they'd had clients that wanted to explore extrasensory perception, and 51% with psychic healing. This study also showed that 83% of health professionals hadn't taken part in any training or courses about these topics, so they didn't really know how to work with the anomalous experiences. And 35% expressed the need for more training in this area. So I'm currently in the process of analysing data that I've collected involving focus groups with counsellors, trainee counsellors, to find out what they think would be useful in their training programme. This is with the intention of maybe designing some workshops and continuing professional development programmes that could help counsellors, so they're not so shocked when they get a client that reports an anomalous experience. So this brings me to my study, my interviews with counsellors in terms of how they worked with clients. So again, there was 8 participants, 8 therapists that took part in the study, and it consisted of 2 males and 6 females. And the length of time practicing varied between 4 to 27 years. And again, their therapeutic orientations included transpersonal, integrative, cognitive behaviour therapy, hypnotherapy, psychodynamic, and gestalt. So a kind of range of different therapeutic orientations. And they'd worked with clients who'd reported at least one anomalous experience. And there was 5 themes that came out from this. So the first one is testing the waters. So the counsellors said that their clients kind of tested the waters first. They might mention something like meditation to the therapist, just to see how the therapist would respond, just to see whether it was safe to then kind of share their anomalous experiences. Exploration, not explanation, was a theme that came about where counsellors felt it was important to explore the experience but not explain it. So they really thought it was important to explore the meaning from the client's perspective and not to try and impose their own values on the client. The therapist may have their own theory of what's going on based on kind of psychological theories, but it was important really to get the client's understanding of the experience first. It's special, but it's not unique, represented how important therapists believed it was to normalise experiences. It might be really special for the client and it might kind of help them and be comforting, but it was important as well when the clients were distressed to actually normalise the experience and, actually tell clients that it's quite common to have experiences like sensing the presence of the deceased. Forewarned and forearmed was a theme that came out in terms of training. So it was really important, they felt, for therapists to have some understanding of all the different research around anomalous experiences so that they were kind of forearmed in preparation for working with clients. Some therapists felt that working with anomalies was no different to any other issues, like working with anxiety, working with depression, working with trauma. What was actually important was the relationship that they had with their client, that they were able to offer the client empathy and core conditions and kind of take a whole person approach. So should be coming to the next slide then. So just to kind of summarise from what we've looked at already, do we need clinical parapsychologists? Is there a need for this new breed of professional? Is there a need for this research area? Well, we've shown that kind of lots of surveys have shown that people do experience anomalous experiences and that some common reactions may include fear, anxiety and distress. We know that mainstream healthcare, at least in the UK, tends to ignore the transcendent, transformative aspects of anomalous experiences. So it's argued that we do really need a new way of working so as to be able to integrate alternative perspectives. We need to move away from a one-size-fits-all kind of model. And it's argued that clinicians might benefit from having knowledge of parapsychological research and theories in addition to counselling skills. But I guess most of all, what it really shows is that they really need to listen to their clients. There's some references here for further reading, some of the books that I mentioned before in the talk, and some of the other ones you might find useful as well. The one that's in bold is Perspectives of Clinical Parapsychology. That's a summary of all the different research findings that's been conducted at those counselling services in Europe. And then there should just be one last slide. One last slide with my email address in case you do have any questions about anything I've talked about today. but also I thought I'd give you a link to another project I'm involved in that's related to this topic, and this is a survey on help seeking following an anomalous experience. So this is for people that have had an anomalous experience. We're interested in finding out where they go to seek support. Do they go to see counsellors, or do they prefer to go and see a spiritual pastor? Do they prefer to go and see their GP? Do they just kind of try and get through the process on their own? So if anybody would like to take part in that, that would be great. Thank you very much.
Good job. I think everybody was very happy with the presentation. We had a lot of conversation going on, and it was a resounding yes to we definitely need this type of a specialty going forward, not just in the UK, but all over the place. Kabayan Mark was asking, many people fear going to the shrink, and discount the parapsychologist due to peer pressure. They're conditioned to want drugs and medicine, but actually, when they know they can help themselves, they're a lot happier. So do you find that kind of in your research, those kinds of attitudes?
Yeah, definitely. And I think also based on my own kind of previous experiences of working in the National Health Service in the UK, I worked there for about 7 years as an Assistant Clinical Psychologist. I often found that when people had experiences, any kind of mental health issue, actually not just anomalous experiences, the fear actually came about from being labelled as mad. That was actually worse than the experience that they originally went to seek support for. And a lot of people didn't want to take medication, but that seemed to be the kind of default mechanism. So, you know, you can really see the kind of pathways into the mental health system that people could follow. If they didn't find appropriate support, if they went to their GP reporting some of these anomalous experiences, there is a risk that they would be given, mind-altering medication, and that would perhaps numb and block and stunt their growth. They may even risk being sectioned and end up on a psychiatric ward. And it kind of risks any kind of, really kind of stunts hope that they may have for recovery when they're told that they have a biological brain disorder.
Exactly. Back when you were talking about, I think it was the STL90, we were looking for a definition and description of what that's used for.
Was that the symptom checklist?
Okay,
Yes, it's a kind of, I forgot to mention that. It was a symptom checklist that looks at kind of mental health. And I think it was the people that have reported near-death experiences. They actually scored high on that, suggesting psychological distress, but they didn't score so high that they would be given a label of a disorder.
I think Alexander Morera and his group has used that as well, looking at Spiritist mediums. Bill Everest was wondering if you're familiar with the ACIST. Bill, do you want to check that out, or are you familiar with it?
Sorry, say that again.
ACIST.
I think so. Yeah, is that over in America? Yeah. I think the Parapsychology Association have set up an anomalous experiences and mental health committee, and I think they are involved in that.
Okay. And any other questions or comments, folks? Now's the time. Yeah, Bill says that's what it is. Lots of applause. I'm trying to get down here to the bottom.
I'm sorry you didn't get to see the video clip, but hopefully you can watch that later.
I think most of the people, I asked for a show of hands, and I think almost everybody got to see the last 5 minutes of it. So, and then we put it into the chat live so they can bookmark it and see it later, and we're going to add it into the class as well. We didn't want to put it in there ahead of time. So,
okay. And if anybody is over in the UK in June, the Emma Bragdon, who I mentioned, who's the American clinical psychologist working in Brazil, she's actually doing a weekend workshop over in Norfolk for the weekend, which aligns with the Spiritual Crisis Network UK conference.
Great. Well, thank you very much. It was a wonderful presentation and very informative, a lot of good information, and I think we have both people who are interested in the psychological side of the field as well as experiencers of various shapes and forms, ministers and mediums and so on, and people are very happy to hear this kind of an approach, and especially your emphasis on listening rather than anything else. Yeah, I will. Carlos and Lisette are going to be coming into the room, and we're going to say goodbye to everybody, and thank you for coming along and being here with us today. As always, this presentation will be available to you hopefully in a couple of hours, and if not, for sure tomorrow. We'll keep an eye on that as well. And although I have not managed to copy the chat straight through, we do have Elizabeth's chat, so that'll be posted up later. So let me turn my camera back on, and you can hang around there, Elizabeth, if you want. People are just going to kind of push it. We can see you, Lisette, and just wave goodbye, because we can see all of you guys back there, and everybody lean in. I can see Rachel and David and Chris and there's room on the camera. So thank you, everybody, for joining us today. It was a really wonderful day and a first for the foundation. And be sure and revisit the classroom. We'll all be there on and off over the next couple of weeks. If you have any questions, we'll get them through to people. The recordings will be there, the PowerPoints, and all the rest of that stuff. So everybody, say goodbye.